Good afternoon, everyone. How are we today?
We good.
Good. We're here, right? That's a good start. My name is Joshua Youngs, and so I'm going to go through a whole bunch of information today. You're probably going to forget half of it before I'm done with it. But what I try to do is give you something that you've never gotten before. And so how I got here is what I'll start with. And so it started with Linda. Everybody probably knows Linda. She mailed me back a postcard, which probably all of you have probably seen these little berries, sometimes pink, sometimes yellow, sometimes blue. But they all basically have the same message: send this back and you can get all these great things, or whatever the message is. Some people fill them out. Linda sent hers back. That gave me the opportunity to talk to her. And from there, she got to go through my process. And that's kind of what I'll go through at the end, is how my process works. But so that's how it all started. And then from there, she mentioned that I should talk to Andrea. I talked to Andrea. She mentioned that she didn't really have a resource for insurance or Medicare. So the name of my agency is Medicare Peace of Mind. I'm the sole owner of that. I'm the only employee of it. It's my show that I run. So it hasn't always been that way. That's really relatively new for me. June 1st is when I started on this journey where I'm independent. Before that, I spent 13 years as the sales director, which in layman's terms, I was the answer man, the trainer, the recruiter, but I didn't get the easy questions. I always get the, what if it's a full moon on the third Thursday? How does my coverage work on that day? And so over 13 years, I got all those questions from hundreds and hundreds of brokers all throughout Colorado and several other states. And so I've accumulated a huge bank of knowledge on all the hard questions. And I started to learn that I enjoyed spending time with people like you much more than I do answering questions for, frankly, does anybody have an insurance broker that they work with? Okay. Has anybody dealt with one in their life? Okay, and so not all of them are created equal. Unfortunately, not all of them have the right ingredients. Like, I've trained thousands of ladies and gentlemen how to do what I'm doing. Maybe 5 to 10 out of 1,000 become successful. And because it's such a hard industry, Medicare, does anybody think they understand Medicare? I can tell you with confidence there's very few questions you can throw at me that I don't know the answer to. Or have a speed dial to the person who has the answer for me. And so, but in reality, like I said, I've been the end-all stop person for all answers. So that's where my expertise and my knowledge comes from. And so my purpose here today is to educate you. So has anybody ever been to one of these Medicare presentations before? If you have, it was probably going to be different than what I'm going to do. I do everything on an educational basis. And so there's a governmental agency called the Center for Medicare and Medicaid Services. I have to tell them about something like this 3 weeks in advance, and there theoretically could be a secret shopper in this room right now. And so for me, I like to stay on the side of compliance. Did you have a question, Andrea?
No, I'm the secret shopper.
Okay. Andrea is our secret shopper, which is fine because everything I do is generic, and there's no insurance companies' names in here. There's no benefits in here. This is all a generic. Let me teach you a little bit about Medicare, and let me teach you about some of the different programs that go with that. All of you are on your own situation when it comes to the Medicare situation, and each of you have different needs. Each of you take different prescriptions and see different doctors and have a different situation. And so what's right for Trudy is different than what's right for Patricia or Linda or anybody else in the room. Each of you has a different need. And so that's really what I do, is educate you first, and then from there, if you're interested, I'd be happy to meet with any of you on an individual basis to really look at your situation. If you're already in the right situation, I'll tell you that and say you should stay where you are. If you're not, then I'll tell you what might work better for you and the reasons why. Are there any questions before I get into the actual presentation portion? Okay. So today's presentation is geared, and I specialize this for the low-income market. My experience so far with everyone I've worked with in this building, that would fit your description. Does anyone not fit that description? Does anybody feel like they're rolling in the dough? Because you're going to become the best friend of everybody else if you admit it. Okay, so there's programs that are available to help people in your situation. Some of you already know about it. Some people have Medicaid. Some people would have the extra help program for your prescriptions. Some people are having the Medicare Savings Program, which pays for your Part B. But each of those programs you have to qualify for and then apply for it. So we're going to go through some basic stuff. For my agency, when I founded it, I've seen a lot of agents through the years do things right. I've seen people do things wrong. I've seen people do things with integrity. I've seen things done not so with the highest level of integrity. For me, that's my number one thing. And so for each person that I help, I genuinely care about each person. And so Ms. Trudy, I'm getting to know very well. Linda, my clients become not just my clients, they're my family basically to me, an extended family. Each of you in this room are somebody's sister or grandma or mom or something, and so you have family too. And my guess is if we were to call them right now, none of them would want an insurance agent to take advantage of you. And I'm in the same boat, and so I don't want an insurance agent to take advantage of you either. And so I founded it by doing what's right for you. Sometimes there's situations where I have to do what's right for you, and then I don't get paid, and I'm okay with that. And so how it works for me, and so everyone in this room, there's no cost. So I don't send you a bill for my help. I answer questions, no cost. There's never a cost. And so how I get paid and how I put my kids through college and stuff, whatever insurance company you need, Anthem, United Healthcare, Bright Health, Humana, the list goes on and on. I have contracts and relationships with all of them. And so I can just do what's right for you, and then the insurance companies pay me for taking care of it. And so that's how it works for me. So there's never a direct cost, and I'm not motivated by, they all pay the same. The government says this is what the payments are. It changes a little bit on Medicare supplements, but people in your situation with low income, most people are either on just regular Medicare and a drug card or a Medicare Advantage plan in my experience. So my promise is to answer your questions now, before, during, we take an application. That's great. A lot of agents are what I call ghosts, where they like to take the application and then you never hear from them ever again. And so I'm very against that. That goes against everything in what I do and what I believe in, and I want every one of you to know, whether you become my client or not, I'm always here to answer questions. So even if I don't want to work with you at all, but can you answer this question? Absolutely. And so I try to exceed expectations. So if any of you have had an experience with an insurance person, I want that to be, wow, that was a bad way to be treated. This new way with Medicare Peace of Mind is the way I should always have been treated. And again, I do everything at no cost, no obligation. My mantra is that there is no perfect insurance company. There's no perfect insurance plan. There's strengths and weaknesses to each one of these options that are available to you. And my job is to help figure out what your situation is and then use my expertise and knowledge to match you up with the plan that matches up to you better than the other ones. Any questions about me or my agency? Okay, and as we go through, feel free to raise your hand. This isn't just a dictator style for I'm going to speak to everyone. You feel free to participate in stuff. Joshua Youngs, and I'll have cards too, and I'll make sure everyone gets one of my cards and everything as well. So here's the answer to your question too, and there's that's actually from my wedding day picture. But again, if you can't tell already, I really love doing what I do. I have a passion for helping people, and I'm able to match up all the knowledge that I have on this confusing thing called Medicare to people that need the help. And so that's really where I come from. Like I said, every day that's what I'm doing. I'm helping someone's mom or grandma or uncle or cousin or something. The people that I'm helping, that's how I look at them. They're people. You're not just a number to me. I send out a birthday card every year to every client I have, handwritten, and I'll never stop doing that. So most important thing is that's who I work for. I don't work for the insurance companies. You're going to have to take a second base to my wife. I do work for my wife too. But as far as in this industry, I work for you, I work for you, I work for you, I work for you. I don't work for anyone else but your interests. Because the only way that you and I stay friends for a long time is by me treating you correctly. So one big thing for me, I really push for and ask for reviews and things like that. If any of you are computer savvy, or you can ask Andrea, or I'd be happy to show you as well. Every rating I've ever gotten has been either 10 out of 10 or 5 out of 5 or whatever that scoring system is. But that's important to me. I want people to know that it's not just, you don't take my word for it. If you want to take, I can give you pages and pages of people that have recommended how I do things, what I do, that kind of stuff. The kind of stuff that I can help with. And so I don't do everything. I wish I could say I was the end-all perfect agent out there for you that can solve all your problems, but I can help with Medicare, just generic Medicare Part A, Part B questions. I can help with Medicare supplements. I can help with Medicare Advantage plans, prescription drug cards. If some of you have family or friends that are under age 65 and not eligible for Medicare, I can help with under 65, quote-unquote Obamacare, that kind of stuff. Dental, vision, hearing, critical illness, hospital indemnity, final expense, recovery care. There's a whole litany of stuff. Most people in this room, we don't have money to buy most of the stuff on the list. And so this isn't me telling you we're going to sell you this stuff. This is just telling you I can help you with any question that you have. Each of you have a different budget. Each of you have different needs, but I can help with all those kind of things. Almost equally, or maybe more importantly, what I don't do. I don't do homeowner, I don't do auto, I don't do any property casualty, business insurance, anything like that. And I don't mess around with the complex life insurances and annuities and investment stuff. And so for me, it's really the insurance side of the market and where my expertise and my knowledge base lies. Anybody ever seen the Medicare New Book? Anybody ever actually read it? It's what I always say to folks is it's the best way if you run out of Ambien or you can't sleep. 5 pages or less and you'll be out, I promise, every time. But my job is to know that book front, back, inside, and know not only what's in that book, there's a lot of stuff it doesn't tell you. And so my knowledge base goes deeper than just Medicare and you, and I can go much farther into detailed situations, because not all situations are created equal. Some people that I've helped in this building, their situations have been very complex. Right, Ms. Trudy? So sometimes the government makes mistakes. Sometimes the insurance companies make mistakes. Sometimes the doctor offices make mistakes. And so I can help fix problems, not just help fix coverage. So everything in here is accurate as of the 1st of July. Now, the government doesn't change things mid-year, but I'd have to tell you that it's accurate as of 7/1. For the most current information, you want to go to Medicare.gov or call 1-800-MEDICARE. Does Phil resonate with anybody? That's kind of how I feel every year when all these, the commercials, we're close now. We're about 60 days out from when the annual enrollment period is going to come around. The TV commercials start, and the phone calls start, and the mail starts, and everybody's saying, hey, you got to pay attention, that kind of stuff. And so don't feel alone. I've yet to meet, in almost 14 years, I've never met someone who really understood Medicare. And if I run into them, I'm going to immediately recruit them as an agent, because you should be helping other people if you have that level of knowledge. So don't feel alone. But the most important thing, whether it's me or someone else, the most important advice I can give you, find someone you know that you can trust, that knows this stuff, that can counsel and advise you on what you should do. Because trying to keep track of this stuff by yourself, it's really nearly impossible unless you're in it. Problem with original Medicare Part B is it goes 80-20 to infinity. And so if it's a $100 doctor visit and it's $100 and they want you to pay 20% or $20, that's manageable. That's almost like a copay. If it's a $500,000 cancer treatment program or a $1 million transplant, 20% starts to become a problem. And so late 60s, 67, 68, Medicare supplements came into existence. And really that's how it was for about 30 years. And then Medicare Advantage plans came into play. And then January 1st of 2006 is when drug coverage came out. Has that been a big impact to everyone in this room since that happened? Because I can tell you, everyone before that, our wallets were the insurance company. And so that was a big problem. And so what's happening in most of your situations, if you have Medicaid, Medicaid basically takes the role of a Medicare supplement. And so in the model, as I go through the different options, that's kind of where you're at if you have Medicare and Medicaid. We have 2 options when we're looking at Medicare. We can stay on Part A and Part B, get a prescription drug card because that's not covered, and then we either have Medicaid or we have our wallet filling in the holes of A and B. That's option 1. Option 2 is a Medicare Advantage plan. Medicare Advantage plans are the newer part, but these are all private insurance companies. These are the Anthems, the Aetnas, the Humanas, the United Healthcares, the Kaisers. That's what these are. And what these are is they have Part A, Part B, and Part D benefits built into one plan. Within the government, Part A, Part B, it's kind of like a bad parent. Do as I say, not as I do.